Serious. What seemed like a distant problem is now knocking on the door of the United States. An outbreak of H7N9 bird flu has been identified on a farm in the state of Mississippi, and authorities are already on high alert. But why should this news worry you? Simple. This virus has a mortality rate of 39% in humans and has wreaked havoc in the past. The questions that no one is answering: are we facing a new pandemic risk? Can the virus spread to humans? Are containment measures enough? Stay with me until the end, because we will analyze all this and expose the details that the mainstream media is not talking about. Do you think the US is prepared to contain this threat? Leave your opinion in the comments, and if you're not subscribed yet, hit the button now so you don't miss any critical updates like this. Now let's get straight to what's going on. The United States Department of Agriculture, USDA, has confirmed a new case of H7N9 bird flu at a poultry farm in Mississippi, marking the first outbreak since 2017. The detection occurred on a farm with more than 47,000 commercial broilers, and the authorities have already activated emergency protocols to contain the advance of the virus. The alert becomes even greater because this strain has a history of transmission to humans and a high mortality rate, reigniting the fear of a possible new health crisis. H7N9 has circulated before, especially in Asia, but its resurgence in the US raises suspicions. Experts are investigating whether the virus was introduced by migratory birds or whether there were failures in the biosecurity protocols of the farms. The fact that this first case occurred in Mississippi, a state with strong poultry production, raises an alert about the possibility of spreading to other production centers, expanding the economic and health impact. H7N9 has already proven to be a deadly challenger, causing severe outbreaks in China in 2013, when more than 1,500 people were infected and 39% of them did not survive. If transmission to humans occurs in the US, the impacts could be devastating. The government needs to act quickly to avoid an economic and health disaster, but will the measures adopted be enough? This is the great unknown of the moment. The outbreak comes at a critical time, where epidemiological surveillance systems are still recovering from the impacts of the COVID-19 pandemic. The World Health Organization, WHO, is already monitoring the situation closely, as any jump from the virus to humans could have unpredictable consequences. Experts warn that if H7N9 mutates and gains sustained transmissibility between humans, the world could face a new health crisis of major proportions. With more than 47,000 birds affected on this farm alone, breeders are concerned about the financial and logistical impact. Isolation and emergency slaughter measures have already begun, but if new cases emerge, the market may face a spike in chicken meat prices, affecting both consumers and the production chain. The fear now is that this is just the first sign of a much bigger problem. USDA's Animal and Plant Health Inspection Service, APHIS, has already activated emergency protocols to isolate the focus of infection and investigate the source of the outbreak. However, the big question remains: will these measures be enough to prevent the virus from reaching other states? In a highly connected world, containing a virus of this type requires quick action, adequate investments, and an efficient containment plan. Since the outbreaks in China in 2013, scientists have been warning about the need to strengthen biosecurity on farms and expand monitoring of zoonotic diseases. However, many countries, including the US, have reduced investments in these areas over the years. Now, with H7N9 back on the radar, experts fear that the lessons of the past have been ignored, which could be costly if new transmissions occur. Although transmission to humans has not yet been confirmed in this outbreak, H7N9 has already shown its frightening lethality. Symptoms include high fever, severe pneumonia, and respiratory failure, requiring immediate hospitalization. The biggest danger, according to experts, is the possibility of mutations that allow more efficient transmission between humans, something that would make containing the virus an even greater challenge. Unlike H5N1, which has also caused recent outbreaks, H7N9 is sneakier. In birds, it often does not cause obvious symptoms, which makes it difficult to detect early. This factor makes controlling the outbreak a real challenge, as the virus can spread silently even before authorities notice its presence. This is one of the great dangers of this strain, and a determining factor for its potential global threat. The case in Mississippi may be just the tip of the iceberg. Authorities and researchers are working against time to prevent this outbreak from taking on uncontrollable proportions. However, the big question remains: are we really prepared to prevent this virus from becoming an even bigger problem? This is a question that needs immediate answers before it is too late. The US poultry industry faces an alarming new challenge. The H7N9 bird flu outbreak in Mississippi could trigger a crisis in chicken production, affecting everything from small farmers to large industries. With 47,654 infected birds already registered, the immediate impact was the emergency slaughter of the animals and the isolation of the farm. However, experts warn that this may be just the beginning, as outbreaks of this type usually generate chain effects in the market. Mississippi is one of the most relevant states in chicken meat production in the US, and an outbreak of this size could compromise the supply chain. The fear is that other foci of the disease will be identified, leading to even more restrictive measures, such as blocking the export of chickens to other states and countries. In addition, the demand for stricter sanitary measures can directly impact production costs, making the final product more expensive for the consumer. Producers are already facing major financial losses as thousands of birds need to be culled to prevent the spread of the virus. Each new case detected represents a significant loss for poultry farmers, who deal not only with forced slaughter, but also with the impact of market distrust. The industry fears that consumers and importers will shun US poultry products, further hurting sales. The market's reaction was immediate. As soon as news of the outbreak spread, shares of large poultry companies fell on the stock market, reflecting investor insecurity. Companies in the sector have already begun to reinforce biosecurity protocols, and some are re-evaluating their export processes to avoid an even greater impact. But the big question is, will this be enough to contain a larger crisis? If new outbreaks are detected, the price of chicken meat can skyrocket, directly affecting consumers' pockets. With the reduction in supply and the increase in demand for alternative meat, other sectors of the food industry may also suffer impacts. Restaurants and fast food chains that rely heavily on chicken may need to adjust their menus or pass on the increased cost to customers. Epidemiological surveillance has become a priority for the sector. The U.S. Department of Agriculture, USDA, has beefed up health inspections and expanded testing of commercial poultry to identify potential new cases before the outbreak spreads. However, experts warn that response time is crucial, and any delay in containment could aggravate the problem. The risk of the virus spreading to other farms is real, and the impact can be devastating. The history of previous outbreaks shows that crises like this have long-term consequences. The H5N1 outbreak in 2015, for example, led to the culling of more than 50 million birds in the US, causing a supply crisis that took months to normalize. If H7N9 follows a similar path, the damage to the poultry sector could be even more severe, considering the risk of transmission to humans. While authorities are sure that chicken consumption poses no direct risks to humans, the public's perception may differ. Fear of contamination can reduce demand for the product, forcing producers to lower prices to maintain competitiveness. The challenge now is not only to contain the virus, but also to control panic and avoid a collapse in the sector. In addition to the economic impact, small producers are the ones who suffer the most from outbreaks of this type. While large companies are able to absorb part of the losses, independent producers often do not have the margin to bear such significant losses. If new infections are confirmed, many smaller farms could simply go bankrupt, leaving thousands of workers jobless and worsening the regional economic crisis. The H7N9 outbreak in Mississippi could be a game changer for the poultry industry. The decisions made now will define whether the sector will be able to recover quickly or enter a collapse similar to what happened with previous outbreaks. However, the big question remains in the air. Is the worst over, or are we just at the beginning of a new health crisis? The H7N9 virus isn't just a threat to the poultry industry. It poses a real and alarming risk to human health. Since its initial identification in China in 2013, this subtype of bird flu has recorded a mortality rate of 39% in humans, an extremely high rate when compared to other variants of the flu virus. This data alone is cause for alarm. But what really worries experts is the potential for H7N9 to evolve and become more transmissible between humans. While the current outbreak in Mississippi has been detected in birds, the immediate concern is whether the virus has already crossed the interspecies barrier. In previous outbreaks, human infection has mostly occurred through direct contact with contaminated birds. But there are reports of limited human-to-human transmission, which raises a crucial question. Are we about to see a new human-to-human H7N9 outbreak? Element? The answer to this question may define the course of preventive actions in the coming weeks. H7N9 is a treacherous virus. Unlike other bird flus, this strain may not cause overt symptoms in birds, making it much more difficult to detect. This means that exposure to the virus can happen without people realizing the risk, which exacerbates the danger of a silent infection. The symptoms in humans are severe: high fever, difficulty breathing, severe pneumonia, and in many cases, multiple organ failure. Previous cases have shown that when the virus infects a human being, the chances of progressing to a critical condition are very high. Many patients who contracted H7N9 required immediate admission to intensive care units and mechanical ventilation to survive. The problem is that if the virus begins to spread more easily, health systems may not be prepared to deal with large numbers of infected people. The history of the COVID-19 pandemic is still fresh in the population's memory, and the possibility of a deadly new virus emerging raises concern among experts. The big question is, has H7N9 already mutated that would make it more efficient in transmission between humans? Researchers from various parts of the world are monitoring the genome of the virus to identify any changes that may indicate an elevated risk of sustained transmission. The World Health Organization, WHO, has already issued statements warning that H7N9 remains one of the avian flu variants with the greatest pandemic potential. However, there are still many uncertainties about its evolution and the real risks of a new wave of large-scale infections. The problem is that the world has faced situations like this before and underestimated the early signs, which cost them dearly in previous pandemics. Health authorities in the United States are reinforcing containment measures to prevent the virus from spreading. But is that enough? Mississippi is not isolated, and poultry industry workers, shippers, and even consumers could potentially be exposed to H7N9 without even knowing it. Vigilance needs to be immediate, as a delay in detecting human infections can allow the virus to circulate silently before drastic measures are taken. Another risk factor is the possibility of co-infection with other respiratory viruses. such as the common flu or even COVID-19. Scientists warn that when two viruses circulate simultaneously, there is a risk of genetic recombination, which could give rise to a new, even more dangerous variant. If this happens, the world could face a much more complex scenario than anyone imagines. The 39% mortality rate of H7N9 is already worrying. But what is really frightening is the risk that this number will increase if the virus undergoes adaptations that make it more aggressive. The world has seen deadly viruses become even more lethal over time, and experts warn that prevention is the only way to prevent history from repeating itself. The problem is, are the authorities acting fast enough, or are we facing yet another mistake that could be costly? H7N9 has already shown what it is capable of, and its return in the US raises urgent questions about global capacity to respond to epidemiological outbreaks. The big question now is, will this outbreak be contained quickly, or are we about to face a new health nightmare? Time will tell, but the actions taken today will define what happens in the coming months. The outbreak of H7N9 bird flu in Mississippi has triggered the highest alert of the United States health authorities. The Animal and Plant Health Inspection Service, APHIS, linked to the U.S. Department of Agriculture, USDA, has already implemented emergency protocols to contain the spread of the virus. Among the main actions are the immediate isolation of the infected farm, the testing of birds on nearby properties, and the temporary suspension of the transport of live chickens in the region. But will these measures be enough to stop a possible advance of the disease? The main strategy adopted so far is the elimination of infected birds. All 47,654 birds on the farm where the outbreak was detected are being culled in a bid to stop the virus from spreading to other regions. This procedure has already been used in previous outbreaks, but experts warn that without close monitoring, the risk of new cases remains high. The presence of migratory birds in the area may pose an additional challenge for the control of H7N9. Another critical point is epidemiological surveillance. The US government has reinforced testing on neighboring farms and intensified health inspections in live poultry markets, one of the main risk points for the spread of the virus. In addition, scientists are analyzing samples to understand whether the virus has already mutated, which could indicate a greater potential for human-to-human transmission. However, there is still no definitive answer on this. Workers in the poultry industry are also under close monitoring. Because previous human infections have occurred through direct contact with infected birds, authorities have implemented stricter safety protocols, including mandatory use of personal protective equipment, PPE, regular testing, and restrictions on access to risk areas. Despite these precautions, experts warn that any failure in the protocols can have serious consequences. The transportation restrictions imposed in the region directly impact the supply chain of the poultry sector. Trucks carrying live birds have been banned from circulating in and out of Mississippi until the situation is brought under control. This measure aims to prevent the disease from spreading to other states, but at the same time affects the distribution of chickens and eggs, which may lead to an increase in prices and shortages in some regions. Research on a possible vaccine against H7N9 has also gained strength with the emergence of this new outbreak. Institutions such as the Centers for Disease Control and Prevention, CDC, and the World Health Organization, WHO, are already working on the development of immunizers to contain an eventual outbreak in humans. However, as this strain of the virus has a history of mutation, there is no guarantee that a vaccine developed today will remain effective in the future. The international community is also closely monitoring the situation. Countries that import chicken from the United States have already begun to reassess their purchases, and some may adopt temporary import restrictions to avoid the risk of contamination. The possibility that this outbreak could affect global trade is real, and the economic impact could be felt far beyond American borders. Experts in the field of epidemiology and biosafety warn that response time is critical. If more drastic measures are not taken quickly, the risk of new outbreaks of the virus will increase significantly. Some voices are already advocating the need for stricter lockdowns and greater transparency on epidemic data to ensure that containment is carried out with maximum efficiency. The big problem is that, in previous outbreaks, containment measures were slow to be implemented, allowing the virus to spread before effective actions were taken. Now, the United States must decide whether to act rigorously to prevent H7N9 from taking uncontrollable proportions or risk reliving past mistakes. The world has seen how quickly pandemics can develop when they are not contained in time. The H7N9 outbreak in Mississippi could be an isolated event or the first sign of something much bigger. The decisions made in the coming days will determine whether this threat will be controlled or whether we will face a new health crisis of major proportions. The H7N9 outbreak in Mississippi is not just another isolated case of bird flu. It is a global alert. With a history of high mortality and the potential for dangerous mutations, this virus could pose an unprecedented health, economic, and social risk. Containment measures are underway, but the big question remains, will they be enough to prevent a greater disaster? If there's one thing history teaches us, it's that underestimating lethal viruses can be costly. We've seen this happen before, with pandemics that have caught governments and health systems unprepared. Now, the question that remains is, has the US learned from past mistakes, or is it about to repeat the same failures? And you, what do you think? Can H7N9 be contained before it becomes an even bigger problem? Are the measures adopted adequate, or are we facing a new potential crisis? Leave your comment and join this crucial discussion. If you want to stay up to date on this and other urgent news, subscribe now to the channel and turn on notifications. Here, you get direct information without filters and with analytics that you can't find anywhere. Don't miss the next video, where we will explore the global impact of this outbreak and what can happen behind the scenes in the industry and international politics.